Well, now that we're into the new year, I know it's a time where we prioritize looking at ourselves, our health, our mind, body, and spirit, as they say. For me, I know I've made a couple resolutions for myself, and I know most people do, but there are certain people who have a hard time following through with those resolutions, and it's not always because they can't or don't have the fortitude to do it. It's sometimes related to other things like access to healthcare, right?
Yeah, absolutely. I mean, we all have goals. Some of us don't reach them. I'm guilty of that. But a lot of people, when we're talking about resolutions, we're talking about like losing weight or eating healthier. But one of the things that gets overlooked a lot, I think, is oral health care. So many things that go on through the rest of your body are just linked to your teeth and gums. Like you can go into a dentist chair and they can look for signs of throat cancer or diabetes, anything that you can think of. So it's really important to go see a dentist because maybe your health journey is going to go off track because of something the dentist could have spotted.
Well, today we are going to have a nice conversation with two of the dentists from our School of Dentistry, Dr. Robert Windsor, and he is the Director of Clinical Operations in the Division of General Dentistry, and Vineet Dhar. Vineet is the Assistant Dean of Postgraduate and Professional Studies in Dentistry. He's also the Clinical Professor and Chair of Orthodontics and Pediatric Dentistry and the Division Chief of Pediatric Dentistry. And that's going to be important as we have this conversation because he has a lot to share about pediatric checkups and well care to avoid traumatic situations later.
Yeah, and the University of Maryland School of Dentistry has a ton of community programs, and we won't get to them all, but you will hear a few of them that are making tremendous impacts in the community.
Okay, so then let's talk teeth.
You're listening to the heartbeat of the University of Maryland, Baltimore, the UMB Pulse.
So Bob and Vineet, welcome to the UMB Pulse podcast. We really appreciate you joining us to kick off the new year, 2024. How did we get here already? But I think it's important that when we're looking at the new year, we can talk about things that relate to health and well-being. And one of those is certainly our dental or our oral care. So I read something recently that says oral health is a critical component of overall health. And why is that? Why would you say that?
So when I was considering that statement, I was kind of looking to see what I could find, and I found that the World Health Organization stated it much more eloquently than what I could. So I'll just read what they defined it. It's quite quick, but they define it as a state of the mouth, teeth, and oral facial structures that enable individuals to perform essential functions such as eating, breathing, and speaking. It also encompasses psychosocial dimensions such as self-confidence, well-being, and the ability to socialize and work without pain, discomfort, and embarrassment. I mean, that really states if we think about our patients, we have patients that come in, they're going to be interviewing for a job and they're missing a tooth or they have a tooth that's black or something along those lines. And that very dramatically affects their self-confidence. And even if they're going to follow through with that application, and the thing that Vineet and I notice is that the oral diseases disproportionately affect the vulnerable populations or the disadvantaged population, and it can be profound effects in nutrition and systemic diseases. So oral health is a very important thing for us.
Allow me to add to that. Dana, first of all, it's a pleasure to be here, and thank you for having us. And greetings to all the listeners. I want to say that regarding the code, simply put, oral health is an integral part of overall health and well-being. Let's think of mouth as a gateway to the rest of the body. And poor oral health will have serious implications on overall health. So from that perspective, dental care is medically necessary care.
Yeah, that's so true. My dentist reinforces that same thought every time I go. He talks about getting good vitamins in your system and everything just that also help affect your teeth. We recently put out an issue of what's called here at UMB the M Dental magazine, which is our dental schools magazine that shares all kinds of interesting information, some of which we're going to talk about today because you've been featured in there. And Dean Mark Reynolds of the School of Dentistry recently said, at the University of Maryland School of Dentistry, expanding access to oral health care is among our top priorities. So let's jump in and talk a little bit about what some of these programs are, what these initiatives look like, and how we are helping to serve that community that may not traditionally get the health care that they need.
Absolutely. Looking forward to the discussion.
And there is so much going on at the University of Maryland School of Dentistry. Overall, with the state initiative, we're celebrating the 1-year anniversary of Maryland Healthy Smiles Dental Program. And that's really critical for seniors, but targets everybody in Medicaid 21 and up. Bob, what does that program encompass and how does it work?
So Maryland Healthy Smiles is the new name of the medical assistance program. And as you mentioned, Charles, it began in January 2023. Essentially, the state combined programs that we had for pediatric patients and also for pregnant mothers that they were covering at that time. And there was another experimental program, but then they moved them into one program covered by one entity. I guess SkyGen is the administrator for that. But they also added 800,000 adults to that. And that was really the big thing for us. And it's a pretty comprehensive program, covers checkups, exams, x-rays, cleanings, fluoride treatments, some emergency treatments. It also covers some things that haven't been well covered in the past, such as root canals, crowns on teeth that had root canals and on teeth that need crowns. And also it covers extractions and anesthesia for that. So it is a pretty comprehensive program.
How was it getting dental coverage before? You mentioned a few things that were added, but does this program make it, I guess, simpler to tap into those benefits?
Yes, it does. I mean, I guess the process, if we want to talk on that for a minute, is that our patients need to make it, to determine whether or not they're part of that Maryland Healthy Smiles program. That's something that they can do through the Department of Health or different things like that. And I would imagine that's probably the same for the pediatric patients. I think Vineet can help us out with that. But once they determine that they do have that coverage, then they can come to the school and we can bring them into our program. We can provide some numbers if you want later on, maybe call center numbers because that's the way to enter into the school. Essentially, you call that and that person who answers the phone determines where that patient's going to be going. They arrange maybe for a screening clinic, and then we can move the person into our system. So that's the way it works for us.
So Maryland Healthy Smiles dental program is essentially dental care for anyone who's eligible for Medicaid services. Mm-hmm. And this is the whole gamut of dental services that can be included in that. They're all covered services. Before, we had a Medicaid coverage for the children under 21 years of age, pregnant women. Now it's been expanded to adults as well. And that's what Bob was alluding to. Coverage has increased, and has this increased advantage in improving access to care.
Great. Thank you for explaining that and adding to that. You can take this in a couple different directions, but what does dental healthcare normally look like for maybe someone who's elderly? Maybe they have Medicaid, maybe they don't, and maybe for others who are underserved that may or may not have coverage and they're looking to get just even basic work done.
For me, I look at dental healthcare as kind of a moving target because it depends upon a couple of different factors. There are financial factors. We all have our priorities in how we can spend our available funds. And sometimes if people are struggling with their finances, they have to take care of childcare, housing, food, things like this. Those become the priorities. So their oral health suffers because they don't have enough funds to be able to handle that. Other things that can fit into it, access to care. Can they drive? Is it easy to get there by public, transportation? Can you get time off of work to visit the dentist? You need your job. You can't take off time because then you're going to lose that job. about. And then your overall general health has a lot to do with as well.
Yeah, and as you said, then if you're not getting that health care that you need, that's going to spill over and affect a number of different parts of your life.
Mm-hmm.
We are excited to talk to you next about the Delta Dental Community Care Foundation Patient Care Grant that was recently awarded to the School of Dentistry. Tell us a little bit about that grant and how that might be different or affect the care that you just described.
This is a project that I began working on not too long after the new Maryland Healthy Smiles came into effect. And the one thing that we discovered in those covered services is that the one area that wasn't covered would be dentures. All right, there's literally no coverage there. There's a gap. I call it a gap in the coverage. Why is that? I can speculate a little bit in talking to some of the folks, at SkyGen, but essentially when they combine some program, pediatric patients and pregnant mothers really don't have a great need for dentures. So they just didn't think about it. It may change in the future. They're always listening to us, or they're good to work with that way. But we contacted Delta about this, and Delta had actually reached out to us before because they wanted to help us with our geriatric population. That was something that they wanted to put some money towards. And so we established this grant that will pick up that coverage for dentures, both partial denture or a complete denture for patients, and covered 100%. It's a $150,000 grant, which is for the average case probably would affect 75 to 80 patients, and we're moving right along with that grant at this particular time. We have probably about 40 patients somewhere in that process who are, we're working towards. It's facilitated through all the different pre-doctoral clinics in the school. It can be the special patients in geriatrics can work with the grant also. But basically the student provider recognizes that if they have a need for financial assistance. The patient basically says to them, I don't know if I can afford that. And so they get talking, and so they go ahead and they contact me to find out if this patient is eligible for that grant. And really the only two criteria are that need to be covered by Maryland Healthy Smiles, and they have to be over the age of 60. Delta originally asked for 65. I prevailed and said, I think we have a greater need. Maybe we can include a few more people, and they were very gracious to allow us to go to age 60.
You know what I think is really encouraging, just that you said they're so good to work with and that they're listening to you, because you have your finger on the community and what really is needed. So Bob, you've mentioned elderly, you've mentioned pregnant women. What about the special needs community? Are they covered by this if they have Medicaid?
At this time, they're not. That's something that we're looking into. Now, I don't have a perfect answer for that, and that is a gap in our coverage because we've had some patients who have some personal issues and they end up losing their teeth at in their 30s, and that's a crisis for that person, because they're still quite young at that point. And so we are working towards getting some kind of coverage for them in the future, but that's another project for us.
Gotcha. So it's not perfect, but it's helping a lot and
True.
growing and evolving. How about in terms of patient success? Like, do you do any types of assessments before, during, after to determine what satisfaction there is with the dental services and how that could also evolve?
The faculty has a lot to do with what goes on during the treatment. In other words, faculty is present for the treatment processes. It's up to us as faculty. Dr. Dhar and I are both involved as faculty in our clinics to talk to the patient and see how they're doing and things along those lines. We do have surveys that we send out after appointments also. That was one of the things that I work with the school. We were sending out email surveys, and we discovered that many of our patients, in fact, most of them probably have a cell phone, but many do not have access to internet or a laptop computer or anything like that, or they don't even have an email account. But we moved it over, and now we send a text out, and they're just 5 questions. So it's nice and quick and easy, 30 seconds, and you can do a survey. And then our response went from about, I think 4 to 5% over 25% now. So we're getting a pretty good response. We get a lot of comments that people make, And then, we literally review these at our quality assurance committee every other month, and then reach out to the different clinics and pass on some of the positives and the occasional negative. We answer that, and we get back in touch with people to find out why it's a negative. It gives us an opportunity to open that dialogue, and if it's something that we've dropped the ball on, we're able to help those people out and move on with it. So I think that's a pretty good process.
Yeah, that sounds great.
Yeah, and you gave some examples of like how this is like transformative for patients and what it means to some of them. Obviously, this creates opportunities for students as well at the University of Maryland School of Dentistry. So take us through about how students get involved with some of these programs.
But mostly the students become involved when it starts with their patient. In other words, when we have our orientation, which happens in June of each year, May to June, as the new classes either move up or a new class comes into the clinic, we start talking about some of these programs that are available. I went ahead and drew up a single page that we could put in our business managers' offices that would specify that, and that way they can hand that out to students as well, so that they stay aware of what we can do. But this Delta Dental Community Care Grant is one of several different grants that we work with. We have another grant that we help people to maintain their teeth. In other words, if a root canal would be a really good treatment, most people can't afford the crown coming in afterwards. So basically, if the patient's able to pay for the root canal, then the grant covers the cost of crowning the tooth and any other work that would have to go into getting that crown done. So that's another grant. The school also has a 30% reduction of fees for people who are in between. Vineet mentioned that we have Medicaid coverage for patients who are underneath a certain poverty level, but we have patients that get stuck in between. They're over that level, so they can't really get Medicaid, but they really can't afford it either. So if they send us information in as far as their income and expenses, and we're able to give them a 30% reduction on our pre-doctorate fee schedule, which is already about half of what it is out in the private sector. So that way it gives them an opportunity to hopefully get some work done and to at least take care of urgent needs and things along those lines.
Absolutely. And that's fantastic, doing that for the community. And as you mentioned earlier, providing another way for students to get involved and have that face-to-face interaction with the community. And speaking of, so Vineet, you're involved with another community dental program that's making a huge difference for children in Maryland for the past decade. So tell us, what does the Oral Health for Underserved, Uninsured Children program enable you to do for families?
Thank you, Charles. Before I respond to your question, I want to share some more information about the program that is, I think, very critical. So a 2016 research paper published in Lancet on global burden of diseases reported dental decay to be the topmost prevalent chronic disease in general health. So it is estimated that about 500,000 of children worldwide have tooth decay in their baby teeth, the primary teeth. And the American Academy of Pediatric Dentistry, AAPD, reports and has data on how untreated tooth decay can impact the child's quality of life. It could be missed school days. It could impact the ability to concentrate on studies, and so on and so forth. So when we come to Maryland, there are about 750,000 children that receive medical and dental services through Medicaid. And about 10 or 11% of those have dental decay. About 60,000 children in Maryland don't have any dental insurance. They're uninsured. And in our experience, the rate of dental decay is 5 times in this population. So if it's 11% in that, it's 5 times more in the uninsured population. Now, if you go to the School of Dentistry, vision statements is advancing oral health and improving lives. And that's what we are focused on. So the Oral Health for Underserved Uninsured Children program, or OHUUC program, is a dental home program, essentially. It's for children from families who have limited income and no dental insurance. So they are not eligible for Medicaid and have limited access to care and, frankly speaking, no other place to go. And this is largely because of their undetermined immigration status, but there are other reasons as well. So we focus on providing care to these families through this program.
Well, that's great with mentioning all the people served through this program and go maybe more into detail about how this is making a difference in the community.
Sure. So we are treating about 500 such children in this program every year. And this is only possible because of our multiple community partners in the area. How it's making a difference? Well, we have developed an innovative and replicable community-based program. When I say replicable, I'm saying its a need is countrywide. It's gaining that national reputation. And the purpose is to promote health equity by reducing disparities. It has enhanced our ability to serve vulnerable populations, regardless of their insurance status. We have created over 1,000 first ever dental homes in the last couple of years. These families are more than grateful. And a non-financial feature of this program is that it has increased patient experiences for our dental students, resulting in more young dentists committing to oral health care for underserved children, and as well as increasing their interest in specializing in pediatric dentistry. So it's a win-win from many perspectives and really making a very meaningful difference in the society.
Now, you mentioned the phrase dental home. What does that really mean for someone having a dental home?
A dental home is an ongoing relationship between a dentist and a patient. So it's an inclusive environment which covers all aspects of oral health care, delivered in a safe, comprehensive, continuous, and a family-centered way, regardless of social or financial barriers. So the American Academy recommends that every child should have a dental home by age 12 months, so first year of life, which is hard to achieve, but we have been advocating strong for it, and we have obviously helped with the financial barrier in this program for parents to be able to reach to us. This is to provide a lifetime of optimal oral health. Our message is clear. We are saying that every child deserves a dental home. And we are saying to the families, yes, we can see the need, and yes, you can trust us. So every child deserves a dental home is what we are pushing.
You received multiple grants over the years to support this program, and particularly from Delta Dental Community Care Foundation and even the Baltimore-based Able Foundation. How are these grants helping you expand your outreach? And I guess it sounds like they're maybe targeting, who they're helping or serving, right?
Absolutely, Charles. I'm reminded of 2016 when we started this program rather. It was a support of $5,000 from Maryland Academy of Pediatric Dentistry to see 25 or 30 kids. And we were seeing in our clinics, families coming to us with bringing their children for urgent care only. So they were not bringing them for preventive care, routine dental care, just for urgent care. So we knew there's a population out there that needs our help. These are Maryland children that need our help. And with the help of these grants, Delta Dental, Able Foundation, Maryland Department of Health, American Academy of Pediatric Dentistry, and now state support, we have come to a position where we are able to support so many more kids. From 20 kids to more than 500 children in a year is where we have reached because of these supporting grants. So a lot of gratitude to these foundations for supporting the right cause and supporting the dental home for everyone's support.
Absolutely. That's a huge accomplishment going from that, small start to how big you've grown. So kudos.
Thank you.
Those numbers are incredible. Coming from a mother's standpoint, if I'm bringing my child to you, what I'm hearing is I'm coming for wellness visits too, right? To try to negate the traumatic care later or the specialized care later.
That is our focus. We want children to come for well visit, get their oral health education, get their anticipatory guidance, which is age appropriate, get preventive care, and hopefully they don't need any urgent care at all. But any routine care that we can get for them, we should do that first. And if they need urgent care, we are always there. So we are open for the urgent care. We allow walk-ins. You can just walk in. If there's a family that doesn't have the insurance, they can just walk into the School of Dentistry, pediatric dentistry clinics with their child, and we'll provide care.
And is there a continuum of doctors that the family will see, or is it just depends on the day you get there?
There is continuity of care for most of the part. It being a residency program, there is a thing that residents graduate and they're new residents after every 2 years. So that is part of the program, the nature of the program. But other than that, it makes the child more comfortable when they're seen by the same provider. So as much as possible, we try to do that.
That sounds great. Thank you for sharing all that about that program. That really does fill that void, one of the voids we talked about earlier. Let's talk a little bit about the Mission of Mercy. That's been around for quite a number of years. And my understanding is that operates out of Shady Grove right now. Can you explain where Shady Grove is and then kind of what that program focuses on?
So the Mission of Mercy is this incredible experience for both patients and students because you get involved in this strictly to do dental care for people. You're not worried about a requirement for a school. You're not worried about whether someone's paying for the service because it's just strictly charity. The faculty who get involved in it, give up themselves. The staff who get involved in it are doing very similar things too. Catholic Charities helps us out. The patients apply to Catholic Charities to be seen in a Mission of Mercy. And so we start to arrange that. We're trying to do it twice a year right now in April and October. We have plans to perhaps add a third time. But it's just a wonderful time to see people and work with people. Some of the things we're in need of for the Mission of Mercy are people that can translate. I think that's one of my deficiencies as an American citizen, as I speak one language. We're very lucky that English is so universal, but we really need to have greater facility with Spanish because that is the second language in this country now. And so many of our patients who come to us from the Mission of Mercy, require Spanish translators. So we have several of the nursing students who come in and help us out with that. Some of our staff members speak Spanish. I think that Vineet can tell you in his pediatric clinic at the school too, there is that great need as well. But Mission of Mercy, generally we see about 120 patients at a time. And like I said, it's just a joyous occasion. The Shady Grove campus is, I think, down towards Rockville in that area. It is part of the University of Maryland system. It's a very, very nice facility down there.
That's terrific. Thanks for that clear definition. So that's happening twice a year, and we'll put information about all of these programs we're talking about in our show notes, of course, so people can learn more and access to get more information.
Particularly for Mission of Mercy, how does someone, if they need care like that, how do they sign up to get a chair?
Essentially, they need to go through Catholic Charities. They apply to Catholic Charities for an appointment. Catholic Charities reaches out. We get a medical history ahead of time, so they become entered into our system, and then they literally schedule an appointment. We do accept walk-ins as well, but we try to schedule a lot of appointments just to get an idea of how many patients we're actually seeing. We schedule about 80 patients. Not all of them show up. That's part of dentistry sometimes. Sometimes the tooth hurts that particular day. And when you signed up for that appointment and you're really looking forward to getting taken care of, but you wake up that morning and it's not hurting anymore. And the fear of dentistry takes over at that particular time and overwhelm the desire to get something taken care of. That's a hard thing for us in dentistry, is that the fear of what we do is a big obstacle to overcome for some patients.
But if you haven't been to the Samuel D. Harris National Museum of Dentistry, they have a lot of great things over there to help kids feel more comfortable about going to the dentist and make it more fun. We also had a previous episode interviewing them. We can put a link to that in our notes as well if you haven't heard that episode. But getting back to the task at hand, Bob, there's that other partnership that began in April of 2023 between the Department of Oral and Maxillofacial Surgery and Total Health Care. And that helps residents in West Baltimore, and faculty are involved with that too. Before you go in depth about that program, I see this term a lot when mentioning this, how it's a federally qualified health center. And not a lot of people probably know what that designation is and why it's important. So tell us about the significance of that designation for this partnership first.
Total Health Care is part of that program, the Federally Qualified Health Center. They're dedicated to caring for the underserved communities in Baltimore. Basically, they look at and again, the income and poverty level in certain neighborhoods, and they reach out to those neighborhoods. So they're in Baltimore. I mean, I could list a whole lot of them, all the way from Bolton Hill to Upton to, Ridgely Salite, Washington Village, a whole lot of different neighborhoods in fairly close proximity to the school. The school is located in a good position to help these folks as well. The oral maxillofacial surgery department reached out to help out with what they can do as far as doing extractions or other things along these lines for patients there, or just to do some general screening. This program, Total Healthcare, is, as it's described, they're looking at both medicine and dentistry together as a full healthcare package for people. And so this is an opportunity for us in dentistry to partner with medical personnel to move on with our patients. We're very fortunate that the new dean of the School of Medicine, Mark Gladwin, is very much involved in a collaborative effort between dentistry and medicine, and that's something that will be coming more in the future. I know that our Dean Reynolds is close with Dean Gladwin, and they're working on that too. So that's something for the future for us. Maybe that gap that we have for our special needs patients can be handled by that too, as Dean and I talked about earlier.
The dentistry school here at University of Maryland, Baltimore is doing a lot of good work in the community. And it kind of makes me think back to, we are one of the primary providers of opportunities for education in professional areas, dentistry being one of them. You mentioned School of Medicine. We actually have 6 professional schools and an interdisciplinary graduate school. We talk about our mission here at UMB a lot. Can either of you comment on just how you feel we are living out our mission through these programs?
As I kind of alluded to earlier, UMSOD's purpose statement is advancing oral health and improving lives. I think with the effort in the direction of our purpose has been to work in all areas of teaching, research, and patient care. And we, I think under Dean Reynolds' leadership, have progressed a lot in this area. Patient-centered care is in the heart of what we do. And we try our best to make it evidence-based. So our faculty, our staff, we're all really geared towards that. And it's not only about the education to students, it's also about how best can we take care of the vulnerable populations, how best can we give back to the community, how best can we train our students, and how can we make sure that all of this is based on good research and good evidence. So I think the School of Dentistry is living to its purpose and really moving it forward.
Really well put. Thank you for sharing that.
Of course.
Absolutely. And we've been covering a lot of different programs through this episode, but I'm sure people are listening or watching thinking, well, I need a crown done. I need maybe an extraction. Where do they go to find out if they qualify for some of these programs? Is there a central website or phone number, whether that's on a national level or even at the School of Dentistry?
If we want to look at Medicaid program, I can provide a phone number for that, which is 855-642-8572. And then the website for that would be www.marylandhealthconnection.gov. So I can provide these. Maybe it's that way you can list them on the podcast later on. But, I had looked those up because, again, earlier, I think we had talked about the prospective patient would need to verify that coverage to make sure that they are covered, and then they can come to the school. And if they want to come to the school, at that point, they want to go through the call center, and I can give that number also, which is 410-706-2801. And so they can talk to the folks that work down there, and they know which clinic to send them to. Generally, they go through a screening process, and then we can direct them to where they can be best cared for.
Thanks for providing those numbers. I think some people might think that it's hard or impossible to get in certain clinics that for people who don't have coverage. So is it a challenge for people to get seen for some of these community clinics, or if they're screened the right way, you're able to find some sort of program, whether that might not be your program, that they might qualify for?
The screening is set up to benefit both our patients and students. One of the weaknesses we had in prior years was that we screened it and then the patient had to be assigned later on. So they ended up entering into this void and sometimes they got lost. So we've changed that. The students are assigned to a screening block. In other words, that's for 5 days are going to be involved in the screening clinic. And at the time that they see that patient, the patient's assigned to that student right away. So there's this continuity of care. So as soon as they're involved in the screening, they move right in with the student. Now, there are times when that case is more advanced. There's a lot more breakdown or different things along those lines, and they need to be assigned to a residency program. Vineet, maybe you can tell us as far as how the pediatric patients come in too along those same lines.
Yeah, thank you, Bob. I think it varies so much depending on different specialties and clinics. But in pediatric clinics, we mostly have Medicaid patients. Again, the same rules and principles apply as Bob was mentioning. In addition, if there is any child or families that have children that don't qualify for Medicaid, are not eligible for Medicaid, they can go through our community partners. They can reach out to a social worker and get referred to us. But let me say this out to your listeners, that if your child is in pain or you have reasons to believe that there are signs of dental infection, simply walk in as an emergency patient during working hours in pediatric clinics. You will be seen. Please don't delay care. And that's what we are there for.
Great. That's an incredibly helpful message. And hopefully a lot of people will take that advice to heart. Thank you.
Before we sign off, is there anything else either of you would like to share? Something maybe we've forgotten to ask or wouldn't know about asking?
I think only one thing I might mention, this is for Vineet's clinic. People often ask, well, how old should my child be before I bring them in for a dentist? So Vineet, I think that's been changing, hasn't it?
Yeah, the recommendation, as I said earlier, we say we start seeing children at age 1. So we want to promote preventive services, oral health education. We'd rather not take your child to a stage where they have decay in their mouth and need to be treated for that. So the earlier, the better. Year 1 of age is where we recommend. That is definitely what pediatrics is strongly advocating now. I'll add to it also that I'm very proud of where I work at University of Maryland School of Dentistry. I think it's a great place for the faculty, staff, our students, and for patient care. We really, all of us, put a lot of hard work and with all sincerity to make it a better place every day. So that's what I'm proud to come here every day, and I really enjoy working. That's what I would add to it.
Well, we are thankful that you both joined us today, and we are very proud to be a part of an institution that truly does make a difference in the community and beyond. So thank you both for what you do every day. Thank you for joining us, and Happy New Year.
I wish I could say listening to the podcast about dentistry will get you maybe $1 or $2 from the Tooth Fairy when you wake up tomorrow, but I don't quite have that budget. But what we can bring to you are some highlights about some episodes you missed about the School of Dentistry that we covered before. That's a present, right?
Yeah, that's a little New Year's gift for everybody. Actually, one little nugget we can share with you is a prior episode of The Pulse, which you can scroll back and find that easily, tied into teeth and health and well-being for children especially. We have something called the Samuel D. Harris National Museum of Dentistry on campus. It was appointed in 2003 by Congress as the National Museum of Dentistry. And that episode, we talk about the museum, we talk about the programs, and they have a really great program for children where it sets children up at an early age to learn about dentistry and what a visit to the dentist looks like. So hopefully it'll take away any fears that they might have the first time they go to the dentist. And Vineet and Bob referenced that earlier today. So we'll put the link to that in our show notes.
There's always something new going on at the museum. So we know that episode is little old on the shelf right now. So check out their website, dentalmuseum.com for updates. The other episode you should really check out is one that came out January of last year, featuring an alum, Catherine Pollock. She created the Planet Smiles Discovering Dentistry Camp. And that's a really cool summer camp that she hosts here at UMB, where she has students from the community as well as our UMB Cure scholars in that program as they're trying to discover potential STEM careers. And they are hands-on in our dentistry labs, working on how to do a filling, how to stitch somebody's gums up after some dental surgery.
Well, Charles, this was a great way to kick off the new year. I think we've provided a lot of valuable resources for our community. I learned a great deal. And as always, I am just so proud to be at a university where we really do make an impact in the community. So happy New Year, everybody, and happy New Year to you, Charles.
Thanks. And don't forget to floss.
The UMB Pulse with Charles Chalet and Dana Rampolla is a UMB Office of Communications and Public Affairs production. Edited by Charles Chalet, marketing by Dana Rampolla.